Hello, my name is Naomi. I'm the service manager and coach for My Health My Way. My Health My Way is, I hope some of you got a leaflet, it's an NHS free service managed by Help and Care, voluntary sector organisation, delivering the service across Dorset, commissioned by Dorset CCG. The criteria to sort of enter the service, so we're providing a self-management support service, we are providing a coaching service to people from the age of over 18 up to whatever age they feel is appropriate. And the only exclusion to our criteria are patients, clients that are at end-of-life pathway. So we really accept anybody into the service. And with that in mind, some of you may be thinking about the appropriateness of some clients who particularly suffer from mental health issues, etc. What we've learned over the period of delivering the service is that we accept everybody into the service, and as Des pointed out, there will be a telephone call to our gateway team, which is in the local Folkestone Centre, and the number to call is on the back of the leaflet. And the conversation with the gateway team member will establish whether the service is the correct service for them and the one that they thought they were phoning up about, coaching service. And then from then, within 2 weeks, they'll be referred to a local health coach who will contact them within that 2-week period of time and just establish what sort of self-management coaching they would like. So who are we as self-management coaches? I'll go on to give you a bit more information about what the service delivers. We're a very mixed bunch, but what we are is we're not clinicians, we're not counsellors, and we're not their friend, and we're not their family member. So what we bring is something really quite attractive to that person who may be struggling with navigating the health system or really prioritising what they can do to support their health and their well-being. And we're that person independent that they can talk to, and we can give them time to listen to their story. And that's really key of the service, is the ability that clients can come and tell their story and feel that sort of weight is off their shoulder, and then from there on sort of through the sessions that we have, find what's right for them and move to managing their goals and working towards goals that are achievable. So how do clients refer? So they can self-refer, and the best sort of referrals are self-referrals, but also we get referrals from clinicians, from medics, etc., diabetic nurses, community nurses, and that's totally appropriate as well. But the best referrals are the ones that those clients make the telephone call themselves, and then they're ready to engage because they feel that they need some support and they need somebody to talk to. The venues that we use for our coaching are very varied. We use libraries, private rooms in libraries, we use community centres, sometimes we use the GP doctor's surgery. We may say to that person, you know, have a good relationship with your surgery, would you feel comfortable using a room within the surgery? And sometimes after a few sessions, a client may feel that they're happy to meet in a cafe because they're sort of on the road to self-managing, and they're quite happy to have a cup of coffee and say, this is how I've got on with my goals, that, you know, I've managed to do that walk around the block 2 times instead of the once, because that was what, and I'm feeling better already about it. It is a personalised service, very much around it's person-centred and what that person feels they want. It's led by the client, so it is client-led. The ways of offering it are one-to-one, group sessions, telephone support, and workshops. Who would benefit? The person that would benefit is somebody that feels that perhaps they're on a bit of a hamster wheel and they've been given all this information, perhaps they've had a recent diagnosis, or they've been there, done that, but they feel stuck and they really just want to take control, and that's the word that we use a lot, control. So having that conversation with an objective person who's on the outside of everything else that's going on, who can listen to them and help them decide what's right for them, not what perhaps their nurse or medic is saying, or their husband or daughter. What do you want? What's important to you? And that is what the service is about. So if you feel that you've got any clients that would benefit from the service, please talk to them about it, and perhaps they could phone the Gateway team.